Good morning, everyone. It's Dr. Groom. I'm here to talk today more about the coronavirus. As we get more and more information, we're trying to keep you up to date with all that we know. We do have a task force at the hospital that is specifically dedicated to staying on top of this coronavirus and providing you guys with more information as it comes out. So we have had a lot of phone calls over the last couple of days to the clinic, and we really appreciate you guys calling rather than coming in. It really helps us to triage rather than having people just walk into the clinic, so we do really appreciate that. I did want to share some updates about testing. So right now in the state of Iowa, we're fairly limited in what we can do for testing. So we go through the Iowa Department of Public Health, and their recommendations are that we test only if you have traveled to a level 3 country, which right now is China, Italy, or Iran. They recommend testing if you are symptomatic, which means a fever over 100 with shortness of breath and cough, only if you have been exposed to someone who is known to be diagnosed with coronavirus, or if you are hospitalized over the age of 60 and have some sort of respiratory illness that we can't otherwise identify. So the testing is pretty rigorous and pretty limited. So if you have fevers and chills, you might need to come in to be evaluated for something like influenza, which is still going on in the community. But we right now have pretty limited testing capabilities for coronavirus. In the state of Iowa, there is no known community spread. The cases that we currently have are all related to international travel. So that should also provide some reassurance that in Dickinson County right now, it's probably pretty limited community spread if there are any cases at all. So again, as testing becomes more widely available, as we get more test kits, we will probably expand that testing, but for the time being, it's pretty stringent standards. We are going to try to do these videos twice a week to give you more up-to-date information as time goes on, and so that you know what's going on in Dickinson County. If you do have a fever over 100, if you have cough, shortness of breath, please feel free to give the clinic a call, 336-2410. Starting today, we are going to have a dedicated nurse line to screen for coronavirus type symptoms. And so you will get shuttled over to that triage nurse where she can decide if you need to come in for an appointment or if it's something that we can have you waited out at home and monitor your symptoms. So again, if you've got questions, give us a call, 336-2410, and stay healthy, wash your hands, practice social distancing. You know, it's always a good idea just to stay 6 feet away from people, cover your mouth when you cough, do all of those good things, and we'll keep you guys up to date over the next few weeks, okay? Thanks, everyone.